Why is vitamin D dosage measured in EU? Imagine trying to compare the strength of different medicines or supplements without a common standard. It would be confusing and potentially unsafe. This is part of the reason why vitamin D dosages are expressed in international units. But what exactly does that mean? And why is this measurement used instead of milligrams or micrograms? International units are a way to quantify the biological activity or effect of a substance rather than its mass. For vitamin D, this approach accounts for the fact that different forms of the vitamin can have varying levels of potency. Vitamin D exists mainly in two forms that are relevant to human health: vitamin D2, also called ergocalciferol, and vitamin D3, known as cholecalciferol. Both can be converted into the active form in the body, but their potency per unit differs. Using international units allows health professionals to standardize dosages across different forms and preparations. For example, 1 microgram of vitamin D3 is equivalent to 25 international units. This conversion helps ensure that people receive an effective and safe amount regardless of the supplement's form or brand. The reason for measuring in international units rather than milligrams or micrograms stems from historical and practical considerations. When vitamin D was first discovered, researchers needed a way to compare the biological activity of different doses. They established the international unit based on the amount of vitamin D required to produce a specific biological response, such as raising blood calcium levels. This method allowed for consistency and comparability across studies and products. Furthermore, because vitamin D is a fat-soluble vitamin stored in the body's fat tissues, its activity can vary depending on individual absorption and metabolism. Using international units emphasizes the biological effect rather than just the weight of the compound. In summary, vitamin D dosage is measured in international units to provide a standardized, biologically relevant way to quantify its potency. This system ensures consistency in supplementation and helps health professionals recommend appropriate doses based on the vitamin's effect on the body, rather than just its mass.